Thank you. Thank you, Undersecretary Zaya. Good to see you. Thank you also to our friend at the State Department and, of course, to Tony Blinken himself. Distinguished guests, I'm proud to be here today to express Canada's wholehearted support for the global coalition to address synthetic drug threats. And I'm joined by my colleague, Dr. Carolyn Bennett, who is the Minister of Mental Health and Addictions and also the Associate Minister of Health. I would like to thank the United States for undertaking this very important initiative to address this shared challenge. President Biden has shown tremendous leadership on this very issue, and as of Tony and, of course, the State Department. The toxic drug supply and overdose crisis is a devastating global trend and is being felt in all our communities. As our US friends have said, there are 3 types of countries in the world today. Those who know that they have a synthetic opioid problem, those who don't know yet, and those that actually don't know that, and those who don't have one yet. So fueled by a toxic and unpredictable illegal drug supply, this crisis continues to take a tragic toll on the lives of those who use substances, as well as their families, loved ones, and communities. Today's illegal drug supply is rife with fentanyl and other highly potent synthetic substances. These drugs are easier to produce, easier to transport, and are significantly more lethal than plant-based drugs like heroin or cocaine. In Canada, the situation is alarming. 81% of accidental opioid-related deaths last year involved fentanyl. And since January 2016, more than 36,000 people died of an opioid overdose in our country. On average, this crisis claims the lives of approximately 20 Canadians each day. Canada remains resolute in its commitment to urgently addressing this crisis. And we're taking action through a renewed federal drug policy that balances public health and public safety priorities. We're taking a comprehensive, collaborative, and compassionate approach, and we take drug-related crime very seriously. Since 2017, our government has allocated over 800 million in funding for evidence-based prevention, treatment, and life-saving harm reduction measures. We have supported law and border enforcement efforts and taking regulatory action on the supply side. And we have done so hand in hand with provinces and territories throughout Canada, with Indigenous peoples and experts, including people with lived and living experiences with substance use. Canada believes in the importance of international collaboration addressing this crisis. We're working closely with partners bilaterally, trilaterally, and internationally to address the illegal drug supply. We know that we're not and cannot be alone in facing this crisis. By working collaboratively with international partners, we're better able to disrupt and dismantle the supply chain of illegal substances. A few important examples are the Canada-US Opioid Action Plan, the North American Drug Dialogue, and the newly formed North American Trilateral Fentanyl Committee. These are helping Canada, the US, and Mexico to bring our policies in law enforcement and border control operations closer together. Canada is also a proud partner of the UN Office on Drug and Crime. And we know that we face immense challenges, but we are determined to overcome them together. Countering illegal and highly potent synthetic substances must be a global priority. Our concerted efforts through the global coalition will make Canadians safer. And I know we are all committed to saving lives. Each life lost is a tragedy that we just can't ignore. Together, we can turn the tide on this crisis, providing hope and healing those who need it the most. Thank you so much.